Welcome back to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, and I am excited that you're here today where we have a huge topic in dentistry. This is one of the biggest topics in dentistry that doesn't get talked about enough. Everybody hates to talk about it and everybody loves to talk about it. It is dollars. Cost of dentistry, how much dentistry costs. But first, today's episode is brought to you by the Patient First Manifesto, the book by which this podcast is named. It is the best way to grow your dental practice, the new way to grow the practice of your dreams by bridging the gap, the great disconnect between dental patients and dental professionals. Why is there this disconnect between dental patients and dental professionals? We describe why, I describe why in the Patient First Manifesto, and also how to bridge it, how to change your practice so that you can deliver dentistry from the patient's perspective. It's easy. It's easy. It just requires a slight mindset shift. But everybody complains about the cost in dentistry. Dentists complain about the cost of every item that we buy. Patients complain about the cost of dentistry. And most studies show that it's the number one reason why people delay dentistry or don't do dentistry. 50% of people don't go to a dentist regularly, roughly. About 25% of people are walking around the United States of America with an active cavity that they know about, but not doing anything about it. And the number one reason is cost. So everybody complains about it, right? So why? That's the big question I want to ask. Because people complain about the cost of lots of things, from gas to groceries to dentistry, right? I do, we all do. So I'm from Minnesota, if you haven't been listening to the podcast for a while. And Minnesotans with 100% accuracy complain about the weather because the weather is very mercurial here. It changes a lot. It's either very, very cold or very, very hot. And then there's a little space and time in the middle where it's nice that Minnesotans complain that it's probably not going to be nice on Thursday, right? So we all complain about the weather in Minnesota, and that is what cost is like in dentistry. But what don't we complain about? Think about that. What are the things that you spend a lot of money on, and we all do, that you're not complaining about? I mean, people buy expensive cars. They buy their house, dinners out that they have where you have a good time. I like good tequila or good bourbon. Maybe for you, it's a different beverage or snack, or you like going to Disney World, or what is it? And people don't typically complain about the cost of those things, right? So the reason why that's pretty obvious. People don't complain about things that they want to spend money on. If you look at the richest man in the world right now runs LVMH, a luxury brand. We're talking about the Hermes scarves and bags. I mean, people don't complain about Bentleys or Porsches that spend massive amounts of money on these luxury brands. And those same people, I bet, do complain about the cost of dentistry, right? And why is that? Well, I believe it's because when you get down to it, adults are just as freaked out as kids at going to the dentist. They just hide it better, right? And why is that pertinent? Because adults don't want to walk around saying, I'm scared, I'm scared. I don't like going there because I'm scared, right? So what do? They talk about things that are socially accepted to talk about, like the cost. Think about it. Who wouldn't want to have nice teeth? Who wouldn't want to have their teeth clean and shiny and nice? Almost with 100% accuracy, everybody would want that. So, what is the real problem? The problem, I hate to say it as a dentist, is how it is delivered, right? That is kind of what the Patient First Manifesto is all about. People would be happy to pay their bill, and pay more, frankly, if you exceed their expectations. If we deliver dentistry the way that Yves Saint Laurent delivers purses, or even Nordstrom's or Target, people don't complain about how expensive Target is, and they're spending way more money there probably than at the dental practice for the vast majority of time. And so I believe that the reason why people complain about cost in dentistry is mainly due to the value. What that means is that the experience that they get isn't worth what they're paying for it. But let's face it, we all know it is from a quality perspective. Think of the massive improvements in dentistry from CAD CAM and the aesthetics that we have. I mean, composites are predictable when 20 years ago they were not. Root canals are pain should be pain free 99% of the time. Yet we still have this archaic idea of delivering dentistry the way it used to be. Now, I think that's problematic because if you think about it, if you took the same an hour long procedure, let's say that costs $1,000 at a dental practice, $1,000 at a dental practice, how much would that cost if you went to say a hospital? Right, you could easily add at least one zero, possibly two zeros to the end of that procedure. So that doesn't mean that $1,000 is not a lot of money. It is, but from a healthcare perspective, dentistry, from a cost per procedure perspective, because you are having a surgery done, you're having something like, say, a crown or a root canal or a tooth taken out. But compared to medical surgery, it is way less cost, just pure dollars. You could argue that dental insurance versus medical insurance is a scam versus a safety net, which I would agree with you. However, that's really just a function of dental insurance companies getting away with it because, frankly, compared to medicine, dentistry is inexpensive, right? So, why do people complain about it? It's because the experience that they have, full stop. That's what it is. That's what it's about. Because, I mean, frankly, if you talk to an attorney now for an hour, it could be my guess that would be interesting to look at is an attorney's per hour, the average attorney's cost per hour, or the average dentist per hour more. It very possibly could be an attorney at this point in time to what's going on with wage increases and legal fees and what's going on in dentistry with consolidation. So, what I'm talking about today is how do we change this? The answer is not usually going to be just to like lower our prices or raise our prices. Because, frankly, like I said, I do think that dentistry is a good value for what people pay for it. However, I think the way we deliver it is the problem. I think if people came to your practices knew if they knew that it was going to be a pleasurable experience. I mean, of course, look, it's not going to be like getting a massage, but it could be where you walk in the door, you're greeted with a friendly person who looks you in the eye, and everybody there who works in the dental practice is happy to be there. They bring you back enthusiastically, and when you have the procedure done, you know it's not going to be painful. That you're going to be relaxed. Maybe you're in virtual reality and you're taken to another place, which is enjoyable. Your awareness isn't even in the practice. You're in Paris. You're on the beach, and then at the end of it, your teeth are clean or restored. I mean, who wouldn't actually, if you think about what we do in a dental practice, people should leave happy because they had a procedure done the majority of the time. Obviously, if you're having a large surgical procedure, there's going to be a recovery and that can be problematic. But even having a crown, you should be leaving feeling good about yourself for having gone in and restored a functional part of your health care, right? Of having your wellness improved. What's that worth to somebody? I would say most people much more than they're paying for it. So the problem, I believe, or not the opportunity, let's call it. If people are complaining about the cost in your practice, think about it. What they're really saying is you're not meeting the expectations that I have for the dollars that I'm giving you. Think about it that way. When people complain about the prices in your dental practice, turn around and say, hey, you know what? I think our prices are phenomenal for the quality of care we give. So maybe there is. I mean, to have if it's a good patient that you've known for a long time, flat out ask them, what could we do to make it a better experience for you so that this would, because frankly, we provide the highest quality care we can for the best price we can. And so then maybe there's something in the experience of us delivering care that we're missing on because obviously there's a disconnect between what we think our services are worth and what you think they're worth and frankly it's not on the quality side. You're getting the best quality product. Hopefully you're delivering the best quality you can. So what is it? What can we do? Is it putting coffee in the reception area? Is it that person at the front desk didn't look up and greet you warmly? Because we want to give you the best experience possible. Survey 20 patients and see what they say. 20 patients that are great patients that are, people that you respect that complain about the cost. Ask them, what would it take for you to think that we exceeded your expectations for the dollars you're given? It'd be an interesting thing to do that I would do if I was seeing patients regularly at this point in time. But so food for thought, cost in dentistry, I believe is not too high. I believe that adults are walking around scared out of their minds because of the prior experience they have, and we as an industry can address that. And what adults say is not that I'm scared; they say it costs too much. So pick up a book, Patient First Manifesto. If you haven't read it, it talks all about this and how to adjust your practice to be in alignment with the patient's perspective and your mindset, which is key, because there are reasons why, and I think they're altruistic reasons why most dentists can't even sense when patients are have too much anxiety, because we're trying to deliver the highest quality care we can. And that to deliver the highest quality care we can, it really requires us to desensitize from our patients so that we can deliver that high quality care. Thank you very much. As always, I appreciate all of you for showing up to the Patient First podcast. Like, comment, subscribe if you have thoughts about the cost of dentistry, which most people do. I'd love to hear about it, and I look forward to seeing you right back here next week at the Patient First podcast.